Welcome everyone to COVID Conversations, a town hall to answer your questions about COVID-19 and the vaccines. I'm Tonette Krousel-Wood, a physician and a faculty member at Tulane, who is leading the Louisiana Community Engagement Alliance against COVID-19 disparities. A little over a year ago, COVID-19 turned our world upside down and left our lives changed really forever. We have experienced a spectrum of emotions from fear, concern, and uncertainty as the COVID-19 crisis unfolded. And of course, now with things seeming a little bit better based on prevention measures and the excellent collaborative research that translated into vaccines that are safe and effective, we're now beginning to see some light at the end of the very long COVID-19 tunnel. Although things seem to be getting back to normal, we are really not out of the woods yet. And we want to make sure that our communities are safe, our families are safe, and that we ourselves are safe. So the purpose of today is to provide you up-to-date information about COVID-19 and the vaccines. We understand that people have questions and concerns, and this is understandable given so many things that have happened. But by having the right information that's accurate and timely, we hope that you can make informed decisions about your getting the COVID-19 vaccine and perhaps recommending it for your family members and friends. We're very fortunate today to have expert clinicians as well as scientists from our Tulane community to be able to answer your questions about COVID-19. And we're also very pleased to have some incredible staff members from Tulane to actually share their stories. So what we'll do is I will briefly introduce our panelists, and then we'll open up for questions that were already provided by the Tulane staff. And then we'll be able to share the stories from our staff members and wrap this up towards the end of the hour. Please make sure to submit any questions that you have via the chat or the Q&A function, and we'll make sure to have time at the end of the session to answer your questions. So I'm going to present our panelists in alphabetical order. We first have Dr. Keith Ferdinand. He's a professor and a practicing physician here at Tulane. He is board certified in internal medicine as well as in cardiovascular medicine. He has conducted numerous clinical trials. He is renowned nationally and internationally for his work in cardiovascular disease. He serves on the Louisiana Governor's COVID-19 Health Equity Task Force and is also an active member of the Community Engagement Alliance against COVID-19 Disparities, or the LA-CEAL. Dr. Lisa Morici, also a professor at Tulane in the Department of Microbiology and Immunology. She has conducted groundbreaking research in the development of vaccines, looking at next generation vaccines, not only for biodefense, but also for emerging and re-emerging infectious diseases. She has conducted numerous research studies funded by NIH and is going to be here today to provide us background information about the development of vaccines. We also have with us Dr. John Schieffelin, another professor here at Tulane University and a practicing pediatrician. He also serves as the chief of infectious diseases for pediatrics and is board certified not only in adult but also pediatric infectious diseases. He has also conducted NIH-funded research looking at viral infections and viral hemorrhagic fevers, including COVID-19. He has focused his efforts on the body's response, body's immunological response to viral infections. We also have Dr. Sabrina Bright. She is a certified nurse practitioner, acute care nurse practitioner, and is also certified as a heart failure nurse. She has received the Florence Nightingale Advanced Practice Nurse of the Year Award, among many other recognition. She is also a practicing clinician and is strongly and vehemently committed to educating patients and her community about wellness and health, specifically to cardiovascular disease, but is also helping us along the lines with COVID-19. We are also very pleased to have Tulane staff member Ms. Belaire Nelson. Ms. Belaire works at the front desk security here at Tulane and at the Tidewater building. She has been with Tulane for 43 years, and we're very pleased that she can be here with us today to share her story. And of course, we have Mr. Evan Currier. He has been at Tulane for the past 6 years, originally from Kansas. He finds New Orleans his home now. He's been a grounds attendant here at Tulane and works primarily at the Uptown campus. So we're so pleased to have our panelists today and our staff members here, and we'll go now into answering your questions. So, Dr. Ferdinand, can you please provide us some insight on why someone should get the vaccine?
Well, you know, I spent weeks, if not months, looking at the ceiling at 3 o'clock in the morning, wondering how we were going to get out of this pandemic. And I could not figure out a way. When the vaccines became available, Pfizer was first with the mRNA vaccine in December, Moderna followed, Johnson & Johnson came later, 2 months later. I now know that the way we're going to get out of this pandemic is through immunization, is through getting vaccination. The numbers are going down in the United States, but it has not gone away. If you look at other parts of the world, India, Cambodia, even the United Kingdom, which did good for a long time, their numbers are going back up. Brazil, it means that the pandemic is here, it's real, and vaccination is the only way we're going to get out of this.
Thank you so much for that answer. Dr. Morici, we have a lot of questions about how quickly the vaccines were made. Can you provide some insight into that, and are they safe?
Yeah, sure. Thank you for that question, Tonette, because, you know, a lot of people think that, you know, the vaccines were rushed. And it's true that these vaccines were developed historically very fast. It was really unprecedented in terms of how quickly the vaccines were developed and then authorized for use in the human population. But what I'd like for people to appreciate is that the technologies that were used for these vaccines, so the messenger RNA vaccines and the adenovirus vaccines, these are technologies that have been in development for more than 25 years. And so it's not like these were new to us. We knew about these technologies. We had been working on these technologies for other diseases. We had even put these vaccines into clinical trials for other diseases. We just didn't hear about it, and it wasn't made public because the diseases were things that weren't pressing at the time. And so once, you know, the other important thing to know about these vaccines is that they were designed specifically for this reason, to be able to quickly adapt to a pandemic or an emerging disease threat, that we could quickly optimize and fine-tune the vaccine to that particular threat. And so these vaccines, by their very nature, were designed to be done quickly. All vaccines undergo clinical trial testing before they're authorized for use in the general population. And so these vaccines, like any vaccine, went through phase 1, phase 2, and phase 3 clinical trials, where tens of thousands of volunteers received the vaccine. And those vaccines were found to be highly safe and highly effective in the clinical trials. And so they were tested just like any other vaccine. We didn't skip any steps. Those clinical trials went very quickly because we were able to enroll volunteers, because people were very happy to volunteer. They wanted to help. They wanted to see this crisis solved. And the other reason the clinical trials went quickly is because we had such a large burden of disease with COVID-19 that we were able to quickly determine whether the vaccines protected us against disease, because there was a lot of disease in the population. And so people that didn't receive the vaccine in the clinical trials, you know, were able to come down with the disease, and people that were vaccinated didn't. And so we were able to tell very quickly that they worked. Those are some of the reasons it went so quickly. None of the steps were skipped in terms of the vaccine development or assessment of safety. And after they were authorized for use, we are still continuing to monitor their safety in the general population. Hundreds of millions of people are receiving the messenger RNA and adenovirus vaccines, and we know they're extremely safe and highly effective.
Great, thank you so much for sharing that. One quick follow-up question. People are worried that the vaccine contains a nanotechnology so that people can be tracked. Is that true?
That is false. So the messenger RNA vaccines are incorporated into what's called a nanoparticle. All that nanoparticle is a tiny little fat bubble made of fats, what we call lipids. And that little bubble is what delivers the messenger RNA to our cells so our cells can read that messenger RNA and turn those instructions into a protein that we can then present to the immune system to mount an immune response against that protein. There's no tracking technology associated with any of these vaccines. Those are myths that are being spread on social media. In fact, microchips, if we think about some of us have had our pets vaccinated or microchipped so that if they escape from our house, we can track them down. Those microchips are at least 1,000 times larger than the nanoparticles in the mRNA vaccines. And so they simply wouldn't fit in the vaccines. And you would feel the chip getting injected under your skin. So no, that's completely false.
Okay, great. Thanks for answering that question. So Dr. Ferdinand, back to you. How effective are the different vaccines in keeping us from getting infected? You've got a lot of experience with this. And how does it apply across age groups, race groups, and gender?
Yeah, well, one of the things that we have to recognize is that we're simple human beings with simple tools, and you still can get infected with the coronavirus if you've been vaccinated. The effectiveness, however, for the mRNA vaccines are close to 95% for hospitalization and for death. And if you look at Johnson & Johnson, it was a different population at a different time. Their numbers were a little bit less, but they were much greater than many of our common vaccines, for instance, for influenza. So in terms of keeping you out of the hospital, keeping you from dying, and keeping you from infecting other people who may be hospitalized and dying, these vaccines are very, very effective.
Do they work in women and men equally? Do they work in Black?
Oh, yeah. You wanted to talk about diversity in the population. The National Institutes of Health partnered with Moderna for that particular one, and Pfizer had the other mRNA. Johnson & Johnson had the adenovirus platform. All of the clinical trials made a special effort to include both men and women, people who define themselves as Black, Hispanic, Asian. They were very diverse. And looking at the numbers across the different populations, they seem to be effective in all the different populations. Pregnant women were not enrolled in the clinical trials, but many of the persons who were in the trials became pregnant. And since that time, it's been calculated approximately 40 to 50,000 women who are pregnant have gotten the vaccine and had no problems at all. In fact, the complications related to coronavirus infection are very high, and the vaccine protects such that the American Obstetrics and Gynecology Association, the people who take care of the pregnant women, recommend that pregnant women get vaccination for coronavirus.
Okay, great. Thank you. That's important information. Dr. Schieffelin, a lot of coming out about getting children vaccinated, and some of our staff members have got children, and they have questions about that. Are these vaccines safe and effective for children? What are your recommendations?
Great, thanks for that question. And yes, they are safe for children. So far, they've been approved for use just for children 12 years and older. For those children 6 months through 11, where those trials are ongoing right now. So hopefully we predict that it'll be approved for that age group, probably, unfortunately, not until early 2022. But for that 12 to 18-year-old group, they are just as safe as they are for the 18 and older group. Children have sadly, well, not sadly, but for me, sadly, more robust immune systems than I do at my age. So children are a little more likely to have fever and fatigue and arm soreness than some of our older staff members, but that's just their immune system doing what it's supposed to be doing in response to the vaccine components. But they are very safe. But staff members should be aware that their teenager may feel a little rough the day of the vaccination, but that's just the vaccine doing its job. But otherwise, they are totally safe.
Okay, so more of a reaction to the vaccine working than a side effect of something going wrong.
Right.
Thank you. Dr. White, many people are asking, can they get COVID-19 from the vaccine? I mean, if they're giving me the vaccine, maybe it's got some COVID in it. Can they get COVID-19 from the vaccine?
Absolutely not. The actual vaccine is not a live virus. It's actually, well, it's not a live virus at all. And so they can't get COVID-19 from the vaccine. However, they can still get COVID-19 if they are vaccinated. And that's one of the things that really needs to drive the family immunity and the families getting vaccinated as well, not just the healthcare providers, but reaching out to those people that are around them or they're going to be in contact with, because they may be the carrier of it even without symptoms.
Great answer. Thank you. We don't want to give COVID any place to grow and hide, right?
Exactly.
We want to get rid of it. Dr. Morici, a lot of people are asking about how long the vaccine will last and are they going to need a booster shot? What are your thoughts about that?
Yeah, so the data that we currently have on participants in the clinical trials that receive the vaccines tell us that it looks like the vaccines are providing protection for at least 1 year, which is great news. And it's possible the vaccines will provide protection longer than that, but we'll have to wait on the data. We don't have the data yet on longer timeframes. But you know, most of us think that boosters will be needed, and there are two reasons for that. The first is that you know, these vaccine technologies, as terrific as they are, traditionally we know that if vaccines are not live replicating vaccines, which these vaccines are not, if they're not in that category, they typically don't provide lifelong immunity. And booster shots are common with non-replicating or non-living vaccines. And so just by the nature of the vaccine itself, we anticipate that it's possible the immunity or the protection provided by these vaccines will begin to wane or decrease over time. And so we'll need a booster shot to increase our immunity and our protection so that we maintain a protective level against the virus. The other reason we think we may need boosters going forward is due to the viral variants and the emergence of viral strains that might escape the protection of the current vaccines. And I think we may talk about that in a little bit, what we know about that. But going forward, we anticipate that we may need to modify or change the vaccine formulation, or at least give additional boosters to protect against the viral variants that might emerge and that are emerging.
Okay, great. No, thank you very much. Great answer and very helpful. Dr. Ferdinand, as a practicing, you know, clinician, and you get a lot of questions from your patients, people are worried about not only just the short-term effects of vaccine, but also long-term effects. Can you share any insight about that and answer that question for our participants?
Sure. One thing that Dr. Morici always says is that the mRNA doesn't hang around. After a few days to a week or so, your body has digested it, it's gone. So there's nothing to test. There's no lingering effects. In fact, the so-called side effects usually happen in the first 1 to 3 days. After that, the person may feel a little tired. Some people have a little longer period. But in terms of long-term effects at this particular point, there are no consistent long-term effects. Now, we can tease out some of the specific concerns. One is the thrombosis of the clots that was identified with the Johnson & Johnson vaccine. We're really not sure how common it is. It appears to be very, very rare. And in fact, COVID-19 causes more clots than the Johnson & Johnson vaccine. The other was the association perhaps with inflammation in the heart muscle in young men or adolescent men who took an mRNA vaccine, either Pfizer or Moderna. Again, that's not proven. And we know that myocarditis, or the inflammation of the heart, happens every spring. So as we start to vaccinate people, they're still going to get things that they may have had anyway. The association of getting a shot and something happened does not mean causality. So we're looking at those, we're examining those, but the news media really doesn't do the population a favor every time somebody says, well, I got vaccinated and my dog bit me yesterday. Well, your dog was going to bite you anyway. So an association is not necessarily causality. If you look at the 200 million people who've had at least one shot, and the main vaccines in the United States are either Pfizer or Moderna, if you had a very common severe complication, it wouldn't be a tweet or a Facebook post. You would see bodies in the streets. 200 million people have gotten these shots, and we just don't see long-term effects at this particular point.
Thank you so much for providing that and also addressing the heart inflammation. We had some questions from some of our participants that came forward in the chat about the inflammation of the heart. So thank you for answering that question as well. Dr. Morici, you know, when we go to get our vaccine, and all of us on this call all have gotten our vaccines, we sign a consent form and they talk about the ingredients in the vaccine. Their questions, are there harmful ingredients in the vaccine? Is there something that we should be concerned about?
No, so these vaccines are actually, you know, quite simple in nature, and they really contain substances that we find naturally in our own bodies, or that are commonly found in the foods that we ingest, the medicines that we take, the cosmetics that we use. So they're really just, it boils down to messenger RNA, and messenger RNA sounds sort of fancy, but we have hundreds of thousands of copies of messenger RNA in our own cells. And so when we deliver the messenger RNA in that vaccine to our cells, it's like a drop in the ocean. Our cells just recognize it like they recognize the rest of our mRNA. They translate it into protein, and then within a couple of days, that messenger RNA is broken down and it's gone. It doesn't hang around. The other components of the messenger RNA vaccines are basically lipids, which are just fats, things like cholesterol, which our own bodies contain, and then sugars and salts. That's pretty much it. And then in terms of the adenovirus vaccine, it's not a live virus. So it's very similar to all of the other vaccines that we get when we're children, except that it's non-living and it's non-replicating, and it's less risky. So no, there's no preservatives. There's nothing harmful in these vaccines. The allergy components are thought to be the polyethylene glycol and the polysorbate in the Johnson & Johnson. So polyethylene glycol in the messenger RNA vaccines and the polysorbate and the Johnson & Johnson. So if you have an allergy or a known allergy to that, you know, the vaccine would not be recommended for you. But again, that's just like a standard food allergy. It's just appeared in the population over time. And again, it's extremely rare and it's treatable.
Okay, thank you, which is why they make you wait for 20 to 30 minutes after you get the vaccine to make sure you're not having one of those types of reactions so that they can intervene if they need to. Thank you, that's very helpful, because signing that in consent form, it always brings questions when you read those parts. Dr. White, we've got patients that are asking this, that they've had COVID-19. I think I've got my antibodies. Do I still need to get the vaccine?
Absolutely. Dr. Ferdinand and I had a conversation actually Tuesday, regarding antibody, people who are positive, who have positive antibodies for it. And the recommendation is that if you get vaccinated, it actually boosts your immunity, even though you have positive antibodies for the virus. So it is definitely recommended that those who have antibodies still get vaccinated.
And I know that they have said that, you know, the immunity you get from active infection is not as robust as what you get from vaccination. The body, it builds many more antibodies with a vaccine than it does. So that gives you better protection. It's almost like a superhero,
Exactly.
Which is great. Dr. Morici, you know, Dr. Ferdinand started to address the issues about getting the vaccine in pregnant women, and that was very important to address that. But there's a question about fertility, long-term fertility problems and issues for men as well as for women. Is there any scientific evidence with respect to the vaccine development that would indicate that this vaccine would have any effect on men or women with respect to their fertility?
Thanks, Tonette, for that question. So there's no evidence that any of these vaccines would have any effect, any negative effect on a woman or a man's fertility, and that is really a myth that's being spread on social media, similar to the microchip myth, and that came about because there's some small similarities between the spike protein, which these vaccines target, and part of the placenta in women. And so someone started saying, oh, well, it's possible that if we mount an immune response to the spike protein, then we're going to mount an immune response to the placenta and it's going to cause infertility. There's absolutely no evidence for that. And furthermore, if that were true, then people who were getting COVID-19, being infected with SARS-CoV-2, that also produces the spike protein, then our immune response to that spike protein would cause miscarriages in women who had COVID-19, and we're not really seeing that. So that is just not a truthful statement. And it's unfortunate that social media has propagated that misinformation.
Thank you. And I think one of the most powerful statements made was when Dr. Ferdinand said, how many women have gotten pregnant who had the vaccine and have gotten pregnant and have had healthy babies and have done well. However, if they had gotten COVID while pregnant, that the outcomes for that group are much worse. But this next question really will be both Drs. Schieffelin and Ferdinand. We'll start with Dr. Schieffelin first. If my child has an underlying medical condition, is the vaccine still safe for my child? And then we'll ask Dr. Ferdinand for adults who have other underlying medical conditions, the same question. Dr. Schieffelin?
There we go. That's a great question, and certainly an important one to ask. And I think the most important thing to remember is that these vaccines, as has been mentioned before, are not live viruses. So they can't replicate within somebody and cause them to become ill. However, for children that have chronic medical problems, especially if they have multiple medical problems that involve their immune system, this is something that they should discuss with their pediatrician. But in general, these vaccines are definitely safe for almost everybody, unless they have a known allergy to one of the components, which, as we discussed earlier, is quite uncommon.
Thank you. Thank you for providing that. Dr. Ferdinand?
Well, let me answer a couple of questions that are tied into that. And what I'm seeing in the chat is the question that comes up time and time: why are we taking the vaccine? You still can get COVID-19. It's not known, it's not proven. Well, the reason we're doing it is because we've had almost 600,000 people who've died. We've done a wonderful job in the United States. We take our bodies, we wrap them up and put them in these nice places called funeral homes, and then we put them in shiny boxes. But if you look at Brazil, you look at India, the deaths, the disability that comes from COVID-19 is real. Young people do die, and young people can infect other people. There's actually cases now of young people who are working in an environment where they're not vaccinated because they think they're invulnerable. They then go work with an older person or someone who's immunocompromised, and they can cause the death of that person. So you're getting vaccinated to protect yourself, surely, but you're also getting vaccinated for the public good. And that's why colleges, hospital staffs, people who work together, you're protecting the group. It's not just for yourself. In terms of the question about the long haulers, we now know that some people will stay sick after COVID-19 for weeks, if not months. It may be as much as 15 to 30% of certain populations. The vaccine doesn't make it worse. In fact, anecdotal evidence is that the vaccine actually helps. The antibodies that you get with natural immunity may be protective. We don't know how long. But if you look at Brazil, that was the place in the spring of 2020 where they were taking bodies with bulldozers and open pits. And the infection that they had in Brazil in the spring of 2020 has not protected Brazil from having infections right now. So that idea that you don't need to be vaccinated, everything's going to be okay, is just wishful thinking. This pandemic is real. The death and disability is real. You're doing it to protect yourself, but you're also doing it to protect others.
Thank you, and thank you for addressing so many of the questions that have come up. I'm going to build on that with another question that's come up in the chat on what your response, and maybe direct this to Dr. Morici. The people are talking about the long haulers from people who've been infected. The question that's coming forward is, if the protection with the vaccine degrades over time, and we may need to get a booster, it's going to have to be updated, why is it urgent that we get the vaccine now? Why don't we just wait until the fall, when fall semester comes?
Yeah, so I think there's a general sense among the Americans, especially, that we're out of the woods. That the case rates are coming down and the death rates are coming down, and I don't need to worry about getting vaccinated now because we're sort of out of the woods. I'll wait till they make them better, protect against the variants. But what I want the people who haven't received the vaccines to realize is that in the unvaccinated population, cases are still going up, hospitalizations are still going up, deaths are still going up. In fact, with the emergence of these viral variants, hospitalizations are increasing because these variants appear to be more transmissible. And so they're slightly more dangerous. We know these vaccines are highly effective against the dominant viral variant here in the United States, and it provides terrific protection against severe disease and death against the other variants that we're concerned about. And so please don't wait. You are vulnerable. If you're not vaccinated, you're vulnerable. The masks are coming off. People are taking their masks off. People are relaxing. You're not safe. These vaccines are incredible. They will protect you. They will keep you from going to the hospital, and they will save your loved ones. So get it. Don't wait. Get it.
Get it down. We certainly, like we said earlier, do not want to give the virus lots of bodies to grow and party in and continue to proliferate and then develop variants that we will have a harder time to address. So thank you for addressing that. Dr. Schieffelin, we talk a lot about herd immunity. We've heard the ranges from 70 to 90%. A lot of us settle around 80%. We know at Tulane, the president and the leadership have set the goal of 90% at Tulane University to make sure that everyone gets vaccinated. What role does vaccination for children play with regards to community and herd immunity?
You're muted, John.
Once again, those are two great questions, or a point and a question. I think, first of all, I want to just quickly address this idea of herd immunity. And I think some people may be confused, perhaps because there are so many different numbers thrown around about herd immunity. And how that is determined is a combination of how transmissible a virus is, and so how readily people get infected. So for some viruses, it might be relatively low. For other viruses, it can be as high as 90+%, for example, with measles, which is extremely transmissible. We still don't know exactly how transmissible SARS-CoV-2 is, and so what that minimum threshold to attain herd immunity is, but it's probably quite high, like well over 80%. It seems to be the general consensus now. So how do children definitely have a role in us attaining herd immunity, even though children don't get terribly sick when they get infected in general. Some of them do, of course, but in general, they don't get terribly sick, but they are still quite effective at transmitting the virus. And as Ms. White and Dr. Ferdinand said, we need to do whatever we can in this vaccine process to not only protect the vaccinee, but to protect all the people around it. That's really the important point. And as Dr. Morici has mentioned, with waning immunity, the more people we get vaccinated, the more people we have overlapping in that different stages of their immunity. And it could turn out that the immunity lasts a long time, but again, we need to get everybody immunized, so including the children, so they maybe, they will protect themselves, but also their classmates who may not be able to get vaccinated or may not have a robust immune system, as well as their parents and grandparents.
Thank you, and it's an excellent answer, and so important to know that when we achieve a high enough rate, that those people who cannot get vaccinated because of medical reasons or allergic reasons, they will be protected. And so it's a community responsibility. So thank you for sharing that. Dr. White, and I know you deal a lot with patients on a daily basis. There are many people who said, I'm just afraid of needles. Is there any other way to get the vaccine other than taking a shot?
No, definitely not. They definitely have to get the shot. That's the only way. Excuse me. I wanted to add to that, we deal with a very high risk population. I want to say my average patient probably is about 65 to 70 years old. But our population jumped on the bandwagon early, really, participated in the vaccination process. We have probably 100% of the patient population that I see are vaccinated and have had both of their injections. So when they started the process of the 65 and older population, I really have to take my hats off to them because they truly stepped up to the plate in terms of being vaccinated. And it helps with their families, because if the older people can get it, why aren't the younger people getting it? And that's that 25 to 35 population. Those are the ones that are carrying it back to the homes. We've had a couple of patients who died as a result of their family members, their younger family members, bringing the virus home to them. And they were inside, they were pretty much homebodies. So it's so important that we push vaccinations, not just to the patients, but to encourage them to have their family members vaccinated as well.
Thank you so much. It's important we all do our part. You're absolutely right. Well, I'd like Miss Belaire Nelson, if she will share her story about why she got vaccinated, and anything you would like to share about that process.
Yes, I got vaccinated because I had two friends that worked here at Tulane. One was hospitalized. She's since gotten out, but the other one passed away. And I guess that was the last straw for me. And having 3 great grandbabies, you know, I want to be around for them. So I decided it's time to do something, get it, you know. And the side effects that I felt was, I took it that morning and I just a little, not flu-like symptoms, but it was just a little weak when I got home. I fell asleep and I slept for about 3 hours. And when I woke up, I've been doing wonderful ever since. In the second vaccine, nothing. I didn't even know I had taken it. I had no side effects.
Okay, that's what, did you do anything special like arm exercises or take Tylenol or anything when you got your vaccine that maybe was
Okay, well, yes, I did. Well, when I took my shower at night, I took and turned the water on the shower as warm as I could, you know, take it. And I let that like vibrate on my arm and it took the soreness right out.
Okay, well, that's very helpful hint for those who are planning to get their vaccine soon. Thank you. Well, now we'll ask Mr. Evan Currier. Tell us a little bit about your experience with the vaccine, why you got it, and how it went.
Hi, good afternoon, guys. Hey, I had multiple reasons for getting the vaccination when I did. One, and the first reason was because in March, the middle to the end of March 2020, I did have COVID-19. It was not a good experience whatsoever. And as a result of me having it and taking it back home, my wife also got it. And she had some breathing issues that went along with it. And it just made me feel terrible, you know, that she was hurting and that she was going through this. And, you know, we went to the hospital and got her checked out, but she was okay. So thank goodness for that. But yeah, I was running 103-degree fever. So it just was not something I wanted to re-experience and go through again. So, you know, the minute I was able to get the vaccination, I went and got it. And just working grounds for Tulane University, you are around many of the students outdoors, indoors when you go in the building. You know, you're touching the door handles, you're touching the faucet handles along with everyone else, you know. So I wanted to make sure that I had that measure of protection, not just for myself, you know, not just for oneself, so that other people would be okay and not get it along with me if I ever got it again. And so, you know, I went through it. And when I got it, first jab, arm was a little bit sore. It's like I did arm day at the gym, you know, after missing it for the last 2 to 3 years. And, you know, it was sore for, you know, about 3 to 5 days, and then it went away. And, you know, you don't feel the shot at all when they give it to you. It's painless. The only thing that I had as far as side effects went were just a little bit of fatigue, a little bit of exhaustion between that 3 and 5 day mark. And I just took, you know, some Tylenol and it made most all of it feel better. Second jab that I got, almost no side effects whatsoever. That was it.
Okay, well, these are very powerful stories. Can both of you share what you would recommend to your fellow staff members at Tulane about the vaccine?
I would absolutely recommend it. Not just because, you know, as a group, we're in the same area and space together, you know, for breaks, for lunch, for when we come in and for when we leave. It's just a good thing to keep to protect others and make sure that you're protected and your family at home is protected. You know, it's, I stress that enough, especially if you have older family members or those that are at risk.
And I think the president will be pleased. Our president at Tulane will be pleased. You pulled in not for oneself, but for one's own into your notes there and into your updates. Ms. Belaire, Nelson, anything to add, or your recommendation to your fellow staff members?
If the virus is available, please get it. You know, don't wait till it's too late or you have a loved one that is not gonna come back to you. Get it, because I had all the myths I heard, I didn't, you know, experience anything like they said. So please get it, stay safe. You stay safe, you keep me safe.
That's a very powerful message. And I will share with the group, we have 2 locations at Tulane. We know it's not the only place to get the vaccine. We have at the downtown location, Monday through Friday, 8:30 to 3:30 at the JBJ building in the atrium. And there's also a site on the Uptown campus in Phelps Hall, which is also available. Some of the hours are more limited, but we'll also share that information. And of course, there's no cost associated with getting the vaccine. And it's certainly, we've tried to make it as convenient as possible for people who want and need to get this vaccine to get it as quickly as possible. Okay. Well, we have a time now to open it up to the Q&A that have come through our chat box and other questions. Let me see. James, do you have a running list of these? Have we answered them all?
I think you've hit several of them, and I see that some of them looks like have been answered by the panelists in the chat as well. The Q&A box tonight you should be able to pull up and look.
Okay, I've got one of them up now, and let me see. So there is one question that came up. There is still fear behind not wearing a mask, even though one has been fully vaccinated. Should there be anything to fear? This is around the masks.
Let me address that one. I think fear is probably not the best way to put it, but I do believe that even if you've been vaccinated, you should protect yourself. We now know that if you've been vaccinated, you don't have to wear your mask in public. You don't have to wear your mask, especially when you're outside. If you're in a closed environment with people whom you don't know whether they've been vaccinated, for instance, I still go to clinic. I have clinic tomorrow. And Dr. White noted that most of, not all of her patients have been vaccinated. Unfortunately, I got the ones that didn't want to get vaccinated. I'm going to wear my mask. I'm in a small room with them. I'm trying to talk to them face to face in a culturally appropriate manner. I have to wear my mask to protect myself. There's this idea that the vaccines are not 100%, therefore there's something wrong with them. Well, we're simple human beings. No, the vaccines are not 100%. You still can get infected, but what they will protect you against is hospitalization and death. So if you're in an environment, in a closed environment, you don't know the people, you really don't know that they are vaccinated, you still should wear your mask. I don't think there's anything wrong with that. And we have to get over this idea that people who wear their mask are somehow losing their freedom. One other thing that we should remember is most of us have not gotten the flu this year, even if you didn't get flu immunization. And one of the reasons is the same mitigation, wearing the mask, social distance, washing your hands, 6 feet, protected us from the flu. And the numbers with the flu went down exponentially. So it's real that if you're sick and you expose yourself to someone else, you can make that person sick.
Okay, great, thank you so much. I see another question. Oh, would you like to add something?
Tonette, if I can just add to that,
Sure.
I think Dr. Ferdinand makes an excellent point. That it is still recommended that you wear a mask if you're on a bus or a train or a plane or in a crowded space, as he mentioned. And one of the things that he pointed out was the decrease in flu, for example, this winter. Now, with all the masks coming off, people should be aware that other winter viruses are now becoming common this summer. So with all the masks coming off, it is very possible to get a different illness that people may think is COVID, even if they got vaccinated. But these are the winter viruses that are rearing their ugly heads in this unusual pandemic summer.
I think that's a great clarification. Thank you for providing that. Let's see, we have a question that came through the Q&A box. It says, I'm fully vaccinated and continue to wear my mask, not for myself, but for my children who cannot yet be vaccinated. I understand that if an individual is vaccinated, we may not get sick, but we can still carry the virus. With the mask mandates being lifted and people gathering into small spaces in large numbers like elevators, I'm greatly concerned about possibly passing the virus to my children who are not vaccinated and have underlying health conditions.
Well, I agree. That basically articulates what I was suggesting. And Dr. Schieffelin can tell you that every year, 100 or 200 kids die from the flu. And we suggest that all people who are over the age of 5 get flu immunization. So the flu shot is given to everybody. Well, 388 to 400 kids have already died from COVID-19. So it doesn't really make sense to suggest that we not vaccinate children once it becomes available for their age group. Right now, for the Pfizer, it's down to 12, because you have a disease, very common, deadly disease, and is actually killing more kids than the flu. Kids are not protected just because they're young.
Okay, that very important points. Thank you. Another question we had come forward is, they say, I personally know many healthcare workers, especially at the nursing and first level care workers, who have refused to get the vaccine. While I recognize people have rights, are hospitals and healthcare organizations taking steps to require their employees to get the vaccine?
Dr. White is in nursing. She's a doctor of nursing, so maybe she can.
Okay, the hospitals are not requiring them to get the vaccine at this point. However, travel, people that want to travel, I know specifically Greece is requiring you to have your vaccination cards or passport cards, as they call them. But at this point, the hospitals are not requiring it. Now, whether they're going to require it in the future, I'm not sure. I mean, because they require you to get the flu vaccine. So I'm not exactly sure whether or not they're going to require you to actually get the vaccines. But I also think that a lot of it stems from lack of education. I think that this is a great panel and it should be shared with nursing or those who are hesitant to get the vaccine, because I think a lot of it is just fear and sort of a PTSD when it comes to COVID. I mean, I hate to use the term PTSD, but that's kind of what it is. They're just fear of the unknown and not enough information out there, correct information out there for them to make an informed decision.
Thank you. And I do know that many healthcare organizations are certainly recommending the vaccine. And for those who are not vaccinated, just as what happens with flu, those in the healthcare setting will have to wear masks and will have to social distance, which at times can make, doing your practice of clinical medicine challenging in those settings. So thank you for those excellent responses, Dr. White. Let's see, this may be a question for Dr. Morici. They're asking that early clinical trials were done using against the classic COVID, not the ones with the variants. So with so many variants appearing, first question is, how effective are the current vaccines against these? You've answered that in part, I think, already, but it'll be good to clarify. And the second, is there any sign of antibody-dependent enhancement?
Oh, that must be a scientist asking that question. Yeah, so great question. So in terms of the variants, we are very fortunate that these vaccines they seem to be highly effective against the current variants. Again, so the dominant variant circulating here in the United States, these vaccines are highly effective at protecting against symptomatic disease with that variant. And then with the other variants, so people typically refer to them like the South African variant, the Brazilian variant, that we also have seen here in the United States. It looks like the vaccines are very, very good at protecting people from the severe disease, hospitalization, and death. We're continuing to monitor people who have been vaccinated with the different vaccines, so the mRNA vaccines and the adenovirus vaccines, and we're looking for breakthrough cases to assess whether or not perhaps one variant is able to break through, meaning cause infection in a person that has received one particular vaccine over another. So we're carefully watching for that, and we could certainly make an adjustment if it looks like one vaccine is less effective against an emerging variant, but we haven't seen that yet. So short story is that the vaccines are highly effective. They're going to protect you against the current variants that are here in the United States. But we are worried about the emergence of variants that could escape the vaccines, and for that reason, there are clinical trials that are underway to look at the efficacy of booster shots and whether the booster dose can protect you against the variants. There's evidence that it can. So just basically raising your immune level even higher can give you even added protection, even if the virus looks a little different. In terms of antibody-dependent enhancement, that's a term that's used to suggest that if we mount an antibody response to one virus, that if the virus looks slightly different, our antibodies might actually bind to that and promote uptake of that virus into our cells, where it can enhance replication of the virus and cause worse disease. There are examples of that with dengue virus, for example, where one type of dengue, if you have antibodies to it, you get worse dengue if you get a different type. So far, there's no evidence of antibody-dependent enhancement for the SARS-CoV-2 coronavirus. So that is quite a relief.
Okay, thank you. That's excellent information to have. Let's see, we have another question where one of the participants says that they find that the stats may not be correct and that they're very confusing. Do not want to be disrespectful, but I'd like to know if the leading scientists value another method, such as a combination of dodging the virus and vaccinating those who are highly symptomatic, extensively educating the immune system, and not grouping everyone into that small group in which the vaccinations are proven to work and antivirals for the less symptomatic. In other words, do we need vaccines for everyone, or can we use another method? Would it be as effective?
So, I'm obviously a huge advocate for vaccines. I think the vaccines have proven that they save lives, that they are continuing to save lives, and that the best evidence for that is in the unvaccinated population. That's where we're seeing the case rates increasing, the hospitalizations and deaths increasing. In the vaccinated population, we're seeing case rates falling, hospitalizations and deaths falling. In terms of the antivirals, I think maybe, Dr. Schieffelin and Dr. Ferdinand can jump in here, but, I'm not convinced that we have really good treatments for COVID. Our doctors are doing a much better job at taking care of their patients. They know what to look for. They know how to prevent blood clots. They know how to treat the respiratory, parts of the disease. But in terms of really effective antivirals, and Dr. Schieffelin, please jump in here, we don't really have any that are just sort of a magic cure for COVID. And so trying to target people once they have disease is tricky. At that point, you're trying to save their life. A vaccine is going to prevent you from getting infected and getting disease. That's what we want.
Yeah, I think that's exactly right. And most of the studies on treatments have been done in hospitalized patients, not all, but the majority of them. And that getting to that point where you need hospitalization is what we want to avoid, right? People who get hospitalized, they not only are in the hospital for a long time, they're very sick. Many of them have lots of long-term health problems. 1 or 2 shots in your arm can prevent all that from happening. And if I can just add one more thing about the statistics and the studies, we have these different phases of studies, and the phase 3 studies that I think this participant is thinking about. Those are really designed to look at the effectiveness of the vaccine at a large population. And if the study is done correctly, as Dr. Ferdinand mentioned earlier, it includes a wide range of ages. It includes a balance of both men and women. It includes lots of, a good balance of races and ethnicities. And that's what we want in a good study. And that's what I think we've gotten from these recent studies as well.
Dr. Krousel-Wood's one cautionary tale that I would suggest to those who really feel that they don't want to get the vaccine is the United Kingdom. They were actually ahead of the United States in terms of vaccination. Their rates were coming down really rapidly. Then about a week or two ago, they started to plateau. Do your own research, look up your own statistics. United Kingdom is starting to have a rise. The variants, probably from people who came in from South Asia, have taken hold in certain parts of the United Kingdom. There's no magic bullet. The vaccines are not 100%. If we start to gather and cough and sneeze, we can not only transmit the variant, but even the wild type virus. There's no magic bullet that's going to stop us from having another spike. We need to do the right thing. If you don't have severe allergies to the vaccine, or you don't have another reason that your physician suggests you don't get it, you should get it. Not only to protect yourself, but to protect those other people who are older, have diabetes, kidney disease, sickle cell, immunocompromised, because there have been cases of people who are fairly asymptomatic, meaning they don't have any bad symptoms, causing infections in others and killing others. So it's a public health intervention that we're doing, not perfection, not magic. We're not God, we're not giving out life, but we can protect each other as a group from having unnecessary death and disability.
Excellent points, Dr. Ferdinand. And as a preventive medicine physician myself, I fully support taking care of the problem upstream, knowing people who've been the COVID-19 long haulers. I don't want to take the chance that I'll get it and have to wait and hope that the antivirals work, right? I would rather not have this. And for me and everyone in my family, we're all vaccinated, including my children. Because I know how important this is, that we put a lid on COVID. We do the right thing, not only for ourselves, but for our communities. And thank goodness we are many decades from what it took to develop the polio vaccine, which our generation really doesn't know. It took them 8 years to develop the polio vaccine. And think of the deaths and the disfigurement that occurred in those 8 years waiting for that to be developed. Here we are in the current era with a safe and effective vaccine with over 200 million people already receiving one dose, side effects really very rare, and an opportunity to for us to really get back to the business of living and being productive citizens, and away from the fear and the uncertainty of what this COVID-19 crisis brought us. We have just enough time for everyone to give one parting phrase as a recommendation to our participants here. We're so pleased that everyone could join us today, and we look forward to seeing us achieve our 90% vaccination rate at Tulane University. Evan reminded us that the president has promised a celebration of President Fitz if we achieve that, in addition to the incentives for demonstrating it. So we'll just do a round robin. Dr. Schieffelin, final words?
The best vaccine for you is the first one you can find.
Thank you. Excellent. Ms. Belaire Nelson.
Get the vaccine. It's free. Get it. Save
Perfect.
lives.
Perfect. Mr. Evan Currier.
I would say get the vaccination as soon as possible. Let's get to this end point. Let's get to the light at the end of the tunnel, and let's stay there. And if you don't get the vaccination, if you still don't want to do it after listening to this, keep social distancing, wash your hands, just listen to the doctors and the medical staff and the people that have been studying this for months, if not years already. Listen to them. Don't listen to the car salesman.
Excellent. Dr. Morici.
For those of you who fear the vaccine and fear the unknown, let me just tell you that our bodies are amazing. They are amazing in what they face every day, and what we're exposed to, and what we put into our bodies. The vaccine itself, compared to everything else we encounter in our lifetime and daily during our normal activities, it's just a drop in the ocean, folks. Our bodies handle it no problem. Please don't fear it.
Thank you. Excellent. Dr. White. Still on mute.
Saying get vaccinated, but if you're not going to get vaccinated, at least know your status.
Okay. Thank you. Excellent advice. Dr. Ferdinand, bring us home.
Get vaccinated for yourself, but even more importantly, do it for others. Do it for that older person, the person with diabetes, the person with end-stage renal disease on dialysis. If you infect them, you can harm others.
Mhm.
Perfect. So everyone, remember, we do have opportunities uptown and downtown to get the vaccine. You can register online. Information is also available on the Tulane website. We look forward to seeing us all at a celebration with 90%, at least 90% vaccination rate at Tulane. Thank you all for your time and attention, and many thanks to James Zanowitz for his help and support in coordinating today's event. Thank you, everyone. Have a great day.